This is a story that flew under the radar a little bit, hasn't received a lot of attention, but it could really change the way that you get health care. Nebraska just joined 20 other states that allow nurses with advanced degrees to practice without the oversight of doctors. 8 more states are also considering it. In fact, it's part of a solution to doctor shortages that are happening from coast to coast. The question is it always good news for patients to see this happen? Let's talk to Dr. Daria Long-Gillespie, ER physician at Emory University Hospital and Executive VP for Clinical Strategy at ShareCare. So, Doc, what do you think about this in general? A lot of strong opinions out there about why this is a good idea, why it's not. Where do you stand on it?
You know, Jenna, as an ER doctor that works closely with and really respects my nurse practitioner and even physician assistant colleagues, I think that the very best medical care we provide is when we collaborate together. Now, that doesn't mean that I'm physically looking over their shoulder, but I'm available when they have questions. We periodically review the cases that they've seen and are able to discuss really complex management cases with them.
So hearing that a law could make it that the oversight would not be legally required. So right now in a lot of states, if I was a nurse practitioner and you were the doctor I worked under, I would sort of report back to you. I would be working underneath the umbrella of other doctors, but this would allow me to basically work independently. What do you think is the risk there to patients? Is there a risk?
Well, I think the really important way to frame this question is not can we substitute a nurse practitioner for a physician or vice versa. Each of them have their strengths and weaknesses, and you can just start by looking at their training. Physicians, on the one hand, have about 20,000 hours of training and a nationwide accreditation. Nurse practitioners have about 5,000 on average and accreditation that varies by state. On the other hand, nurse practitioners, many of them have spent years really understanding a specific area of management like prevention. And they also have more time to discuss conditions with patients and educate them and motivate them. So it's not replacing one. It's not substituting. It's using them to extend each other.
Well, it's interesting because I think when you look at these articles, at least on this law, it looks like patients are trying to substitute because for a variety of different reasons. They can't get in to see their doctors, or they like the relationship they're able to have with their nurse practitioner because it might be different than that with the physician. And you touched on something really important that I wanted to underscore for our viewers, though. The big difference between, let's say, a physician's assistant and a doctor is the clinical hours, the essential, I don't want to say practice, but in some cases it is. The hours that you're putting in to actually get the title, is that the biggest difference between the two?
It's a combination. So for a physician, it's 4 years of college, 4 years of medical school, and then often 3 to 5 to 10 years of residency and fellowship, which a physician's assistant and nurse practitioner don't do, so they don't get that definite breadth. But many of them really focus on specific areas in which they have good strength.
The American Medical Association was very strong on this. They say that nurses lack the knowledge and skills to diagnose complex illnesses. I know you're not going that strong because you actually, as you mentioned, you like the teamwork with your entire group of people that you work with. But is there something that our viewers should know if they decide to go to a nurse practitioner in their state? Any advice for them?
Yeah, absolutely. And some of that comes from a nurse practitioner colleague of mine that I was speaking with. And she's an expert in the area of OBGYN. And she says that many physicians often come to her to talk about what oral contraceptive or birth control to prescribe to a patient. But if it's a pregnant patient that has a lot of complexity or becomes unstable, she's very ready and willing to go to work with her physician colleagues.
I see.
So I think that's very important, is knowing when you need to go to a physician and having them available so that a nurse practitioner isn't totally in isolation on their own when they need that support.
Some good advice for us, Doc. Great to have you on the program again. Thank you very much.